All right. Has anybody any questions or problems that wants help with? Yes?
Hora, I'd like to pick up on something we dealt with a few sessions ago, last meeting ago, and that was a case that I presented, in which it was a young teenage boy who had a problem with ambition.
Yeah.
And he was somatizing a number of his problems. And you had mentioned at the end of the class that one way this boy is to help him to focus in on aspiration. And I wonder if you talked a little before about that existential knowledge, the fog.
Was it the boy that we were having in mind, or the parents?
Well, the parents were pushing him, yes, that you had picked up on to work hard in school. He was in sports. The boy was very angry, but did not expect to be angry directly.
How old is the boy?
The boy's 14.
14. Right. Now, with a 14-year-old boy doesn't have yet the capacity to distinguish between such a subtle conceptual differences, ambition and aspiration. It would be very difficult. It would have to be an extraordinarily bright boy. And it is meaningless to him. We reach the children through the parents. And we don't reach them conceptually, but existential. What is the difference? There are an awful lot of people who go to lectures and graduate from colleges and take courses and study this and study that and read this and read that. They know everything about everything. But nothing is happening to them as far as their mode of being in the world is concerned. Because everything remains information. Now, in psychotherapy, we can waste an awful lot of time if we conduct our work on the level of information. Because information has very little therapeutic value. It is the difference between a teacher and a therapist is that a therapist can communicate the same concept in such a way that it will not be information, but it will lead to transformation. In traditional psychotherapy, a great deal of attention is being paid to the problem of intellectualization. And it is believed that the remedy to intellectualization is the encouragement of emotional integration. That if a patient has a tendency to store information on a conceptual level, then what he needs is to be encouraged to have emotional responses to whatever is being. It is believed that if a concept can elicit an emotional reaction in the patient, then it has therapeutic value. This is nonsense. Because emotional reactions to concepts are nothing else, just a transmutation of energy in another form. So you can intellectualize and you can emotionalize as much as you want, and nothing will happen. Now, another way of trying to overcome the problem of intellectualism is through acting out, to encouraging certain behavior, a change in behavior. You see, if the emotional reactions to information do not work, have no therapeutic consequences, then the idea was, well, maybe if we teach these people to behave differently, then the behavior somehow will help this conceptual information to become of therapeutic value. This also isn't working. You see, it is very easy to store up concepts and information in the intellect. It is very easy to learn to have emotional reactions, and it is very easy to alter behavior. It has no therapeutic value. Now the question is, what then can lead away from information and bring about genuine transformation? So here, John brought up an example. Here we have a youngster who is developing psychosomatic complications as a result of living with parents who are very ambitious. Now we have analyzed the invalidity of existential invalidity of ambition, if you all remember, and we have come to the conclusion that the alternative to ambition is aspiration. So you can say, well, so we are substituting one concept for another concept. What good will that do? Right? Suppose you were of the Alexander School of Psychoanalysis and you would say, well, you have to somehow get the patient to have an corrective emotional experience from ambition to aspiration. Well, you could somehow guide the patient to like it, to become very pleasantly affected by this new concept. But just because we like it and we have a positive emotional reaction to it, isn't going to do anything. No, you could also say, well, instead of being ambitious, you have to aspire. Learn to aspire for good grades or to be a football hero or whatever he is. This is also not going to happen. What is therapeutically significant? What do you think? The primary significant element is that the therapist embody in himself, that he is embody and be a model of that particular value which he advocates. For instance, if an ambitious therapist were to advocate aspiration to a patient, this would be ridiculous. Now, you could fool some patients some of the time, and many patients all of the time, but you couldn't fool everybody all the time. But even if you would fool some patients, it would have no therapeutic value. The primary requisite is that the patient, that the therapist be a representative, an existential model of those values which he advocates. Which means that his own mode of being in the world is governed by the values which he advocates. Now, a 14-year-old boy can perceive these values in the therapist on a subliminal level. What do we mean by that?
That he experiences them, but that he's not conscious
Yes,
of that.
without conceptually clarifying it to himself. He will be aware of it, right? He will be aware whether his therapist is ambitious or aspiring. But that would be one factor. Now the other factor is that the consciousness of the children can only be reached through the consciousness of the parent. Because children are extensions of parental consciousness. Therefore, what is needed is to communicate his different value to the parents in such a meaningful way that it would lead to a shift in their perspective on life. You see, we are not talking about a corrective emotional experience or behavior or accumulation of information. We are talking in a shift, in a cognitive shift. Where life is perceived in a more existentially valid perspective. Now, we have defined ambition. How? How did we define ambition?
Going in two ways at the same time.
Well, that was the analysis of the root of the word. But otherwise, who would define ambition? It is an endeavor to succeed on one's own steam. The concept of ambition is by definition godless. It doesn't take the existence of God into consideration. In contrast to this, aspiration includes the concept of God in itself. Because without God, it would not be possible to aspire. But certain words are godless words, and certain words include a priori. By definition, they include the possibility of the existence of a higher source of intelligence. Aspiration, the word to aspire means to aspirare. Spirare means to breathe. Aspirare means to breathe in. Which means if we are breathing mentally, it refers to mental processing. To breathe mentally means to take in not oxygen, but intelligent ideas. When we aspire, we are receptive to creative, intelligent ideas coming to us from a transcendent source. Now you see the radical difference between ambition and aspiration. The clear understanding of the difference, and this is the art of the therapist, of being able to bring it home to a patient in a meaningful way, will alter the mode of being in the world. You see, there's nothing to do with religion, and yet it will bring man into contact and a continuous connection with the divine mind. If your energy and intelligence comes to you through inspiration, then you are maintaining an open channel through which God is reaching your consciousness from moment to moment. And this alters your mode of being in the world and your entire perception of yourself as an individual consciousness. So the right understanding of the implications of these concepts can have far-reaching consequences as to how we see reality and how we function in this reality. For instance, an ambitious individual is inevitably a calculative thinker. He is incapable of creativity. He uses his head in every situation. See, not a football field, the head is protected with all sorts of helmets. So ambitious people are using their heads and banging their heads against the wall very often and tend to get very bad headaches. When we understand aspiration, we abandon calculative thinking and we become inspired, creative thinkers. It's an entirely different mode of being in the world. We are not using our head anymore when we understand aspiration. We are not using our heads. We are being used by a higher intelligence. And we don't have to rack our brains about anything, because the right ideas are constantly flowing spontaneously into consciousness. And this is the essence of creativity. Whatever field we are active in, be it in a profession, or in sports, or in art, or in housework, or in labor of any kind, if we understand aspiration, we are constantly being inspired with ideas which meet the particular need of the moment. Everything can be done ambitiously, which is ego-centered, or through inspired wisdom, which is through God, infinite, omniactive love intelligence, which flows into consciousness and makes it possible for us to function effectively and without undue stress. It's an entirely different ballgame. And certainly, to the extent, John, that you would be able to bring this home to the parents, and if they would be able to see this and undergo a change in their outlook on life, their mode of being in the world would change, all the somatic symptoms would disappear. That would be a spontaneous healing. Healing is not possible unless the mode of being in the world is somehow altered. Because all our diseases and symptoms and problems are just expressions of misdirected ways of living. If we don't understand how to live in an existentially valid way, then we are constantly generating problems for ourselves on all levels of experience. And metapsychiatric therapy consists on recognizing the ways in which an individual is misdirected, helping him see it, recognizing the mistake, right? Regretting it, and then reforming. So in mental psychiatry, we don't treat personalities. That is, you see, psychology treats persons. Medical science treats diseases. Mental psychiatry treats modes of being in the world. Clear? Okay. Any questions? Is this frightening to you, or is it comforting? Or disturbing? Or confusing?
To me, it's comforting.
Yes?
Yeah.
That's good. Yes.
How does a person differ from their mode of being in the world?
How does a person differ from their mode of being? What do you mean?
The hierarchy that you presented suggests to me that there is a possibility of a mode of being in the world other than that which a person would present.
Can anybody help me understand what he is saying? Maybe some of you. Nobody?
Well, it's like saying that his mode of being is different from what he is.
Is that what you are saying?
Yeah, that's what I guess. The person will, what is the difference between a person and a mode of being? If a person will present themselves according to their mode of being.
Yes.
And is there a difference? What is the difference between the two? Is Or is it a different way of looking at the same entity? As you spoke, I had the feeling that mode of being was different than a person. That somehow the mode of being transcends person.
Sure, absolutely.
Not just personality, but
Absolutely.
an entity.
Right. Can anyone? You all have a problem with this? Perhaps it would help to clarify what a person is. What is a person? Clark, you seem to know.
It just seems to me like an almost impossible kind of concept to
Person.
define. That persons have qualities or characteristics or modes of being, but to define what the person self is difficult to make.
Oh, it's very simple to define a person. Would you like to know what a person is? Yes?
To me, a person is a spiritual being that has a mind, physical body, and emotion.
And also a skirt or
And
a
what?
necktie.
But whatever he has, but that he is the center of soul, spirit, or
Anybody else? Yes?
I don't think a person is what appears person, but when you say that's a person, the appearance is different.
Very good, Jay. In other words, a person is what we pretend to be. You know the derivation of the word person? Now, what does that mean, persona?
Mask.
Everybody is saying that, but it's not true. Persona means by the sound. Recognizing individuals by the sound, rather than by the mask which they wear. We usually read that that this word person is derived from the Greek operas, Greek theater, where the actors were wearing masks corresponding to their particular roles. So if somebody, an actor, was having to portray as a depressed man or an ambitious man or an angry or a happy man, he was putting up a corresponding mask. But to know who he really is, you have to listen. Not look at the mask, what he pretends to be, but you could tell who it was by the sound. No, you listen on the telephone, you can tell who you're talking to most of the time by how he sounds. So persona means by the sound. So this fact has fused, and we have this word person, and usually interpreters of the word say, well, it means mask. It doesn't really mean mask. But it's derived from the Greek theater where masks are being worn, and of course, the correct definition of person even based on this derivation, is person is what we pretend to be. It's not what we really are. Sometimes we can get a very self-effacing person who wears a mask of gentleness and even timidity, and even humility. And behind this mask, there is an ambitious character. Now, which one is he really? Right. He is neither. How can we know? You see, man is a very complicated phenomenon. He can have one personality which is covering up an entirely different character, and that can be very confusing. And he himself doesn't know it. All this can be just automatic. Most people don't know. This is called, they are having complex personalities. Yeah? We have this problem with politicians who appear on television and present one face, and underneath that face there is an entirely different character. And he says one thing one day, and his actions seem to indicate something else. This is a very difficult problem. Now, a psychotherapist, of course, must have a way of discerning and separating the false from the true, and reality from pretense. Otherwise, we don't understand the patient, and if we don't understand it, how can we help him? Or if we misunderstand, then we are in a real pickle. Yes?
I guess, and you should look at other fruits.
All right. Yes. Well, of course, by the time a patient comes to us, he has already discovered that he is bearing bitter fruit. That's why they come, because the fruit of the mode of being in the world is impalatable.
Well, isn't it worried that they don't know their motivation? All they know is that identification themselves with person rather than motivation.
Right. Okay. So in metapsychiatry, we are not trying to therapeutize a mask and provide the patient with a better mask, right? What are we therapeutizing?
Well, it seems to me that the effort is to have a person understand, know, acknowledge what his particular mode of being.
Right.
He doesn't understand that mode of being.
Right.
No one else is going to. And I guess my question is then, as a metapsychiatrist, when a person as opposed to when a person walks into the office, what then? How do you arrive at, which I know that's a dumb question, but I can't get away from the house.
Yes, it is.
The mode of being of
It's
that.
legitimate, don't worry.
Okay,
It's
good,
good.
yeah.
It's legitimate. Well, this is where phenomenological analysis comes in. It is through the method of phenomenological discernment that we penetrate beyond the mask of personality and discern those values which contributes to that particular misdirected mode of being in the world, which creates the trouble for the individual. I forgot to mention that we don't speak of people as persons and personalities, but as individuals manifesting various modes of being in the world. When we were talking about John's patient, we have discerned that parent manifests an ambitious mode of being in the world, and these false values have created difficulties in the child, which is in school performance, behavior, and psychosomatic complications. Now, once we have phenomenologically discerned the basic value which dominates a family or an individual, then we have diagnosed the problem existentially. Then we have to help the patient or the family to recognize the source of the problem being a mistaken assumption about life. When they have reached a recognition, for instance, suppose in this case that father and the mother can be helped to see that the problem is not the child, it is not they, it is not the culture, it is not the school system, it is the erroneous idea that ambition is good and important. That's the patient. The patient is not a person, is not a system, it is an invalid concept. And then we proceed to therapeutize the invalid concept. And when the invalid concept is replaced by a valid concept, not just intellectually or emotionally or behaviorally, but existentially, then a healing spontaneously occurs. In all areas of life, when an individual is healed, everything in his life is healed. It's not just patch of job. Total healing takes place. When the mode of being in the world becomes existentially invalid, all previous problems disappear. And this is proof positive of the validity of this approach. Over and over and over again, it validates itself. And it is not difficult, it's not complicated, it's not burdensome or mysterious, it's really very simple. As far as the therapist is concerned, what he needs to be trained in is the art of phenomenological analysis and cultivate his perspectivity of the conscious and unconscious values which dominate the lives of the individuals who seek his assistance. Because you need a history, you don't have to know the background of the place, you just don't have to know anything. You just sit down with the individual and spend some time and wait for the whole mode of being in the world to reveal itself to you. As a matter of fact, many people who come to us come with preconceived ideas. They'll have to tell us about their father, their mothers, their grandmother, their childhood experiences. And we discourage that. Because the historical background information is based on the assumption of cause and effect thinking, that what is now has been caused by something that was in the past. It's not true. Diseases and problems do not have a cause. They only have a meaning. So we don't have to waste time exploring so-called etiological factors. You know what etiological factors are? Yeah? Causes from the past. You don't have to bother with that. Yes?
It's a convenient way of blaming.
All right. Oh, sure, that's what happens. As a matter of fact, we have a saying, he who seeks reasons only finds excuses. Now, if a patient has an excuse for being sick, why would he get well? It reduces his motivation to be well. Sometimes there is such a thing as secondary emotional gain from illness. If your illness can make somebody miserable, then you have no motivation to become well, because you get satisfaction from the suffering that you can cause somebody in the family. But if there is nobody to blame for our problems, nobody has caused it. You see, the child, the boy could say, well, my parents are to blame that I'm having this, what kind of physical symptoms does he have?
Oh, he has a rash.
A rash?
He has a reactionary stomach just like my father.
Yes. If he could blame his parents for having these symptoms, he would lose the motivation of getting well, even if he suffers a little. Well, they suffer more. But the parents didn't cause him to get sick. Ignorance has caused it, if you want to find a cause. But ignorance is not that person. The whole family shares an erroneous idea about what is important in life. And nobody is to blame for it. It is just an error, a mistake. And that helps a great deal in Reformation. If you cannot blame anybody, it's much easier to reform.
Yes? What is the metapsychiatric understanding of responsibility?
That's a wonderful question, and it would take us about 35 minutes to explain. And if you bring it up next week, I'll be happy to go into that. All right?